Hello friends, I am Dr. Anshuman Manaswi and I am a plastic and cosmetic surgeon at Nanavati Hospital at Bombay Hospital and Chief Cosmetic and Plastic Surgeon at La Transformation Plastic Surgery Center, Mumbai. Welcome to the patient education series again. Today we are going to talk about two procedures. One is a face procedure called facelift, and another is absolutely different, that is lymphedema. So the first, let's talk about facelift. When it comes to face, most of us, and rightly so, get a little apprehensive about face surgeries, and many a times we feel, oh, if something would go wrong, it would probably be worse than what it is right now. As such, people are a little apprehensive about any surgery, and when it comes to face, people want to be doubly sure as to what they are going into, and they want absolutely surety that nothing will go wrong. One such procedure in face is called facelift, and facelift is essentially to tighten a face and make it much more younger than what it is. It is to reduce the wrinkles, to tell in a plain simple words. Usually it's an anti-aging procedure, but face can become lax even after massive weight loss or because of some diseases. So mostly facelift is done for anti-aging procedures, and what we can expect from a facelift, suppose you look at my face, I'm around 50 years of age, and suppose I do a facelift, these wrinkles will go, these will go, and it will come up, and this lower face will also get tightened. So we have upper facelift, mid facelift and lower facelift. And the best way to see whether you're going to get result after a facelift surgery is to do this kind of a maneuver in front of the mirror and check whether you're liking it or not. Now obviously when we are removing the skin to tighten it, there has to be some cuts, some skin has to be removed, so there has to be some scar as well. And that is where the importance of a good job comes into play, to minimize the scars so that it is not visible or minimally visible, or it can be hidden. Almost everybody into film industry gets some procedure of the face to look younger, whether it is medical or surgical. But anybody more than 60 years of age looking really young, you can probably imagine and assume that he has undergone a facelift. There is no procedure medically to tighten this kind of a skin to this level, okay, except for surgery. So a traditional facelift scar begins over here, goes like this, comes back, and in front of your ears, goes back and goes back behind the ear like this. So there is a scar which is there here, part of it is hidden in the hairline or just at the border. Part of it is there in the front of the ear lobe and then going back like this. Now scar depends on many factors. One such factor is the body composition and the ability to heal well and scar well. That is genetic. For example, if we have Western people, white people, they hardly scar because they have different type of different collagen and different scar mechanism, which doesn't make the scar very obvious. reaction to the cut differs from a person to person. In Indians, we also have a spectrum. We have fair people, bordering on to the white, and we have dark people. Dark people generally tend to scar a little bit more. So, in the Indian population, we would have at least 40% of the people who can have a visible scar, and that is where a proper consultation is important. On the side of the patient must discuss this option with the plastic surgeon as to how would the scars be. How likely they are, likely they are to become a little more visible than normal. In general, we as plastic surgeons can say roughly about it as to whether you will scar more or less, depending on your other cuts which you have sustained in the childhood and any other injury marks and all that. So this is the traditional facelift. I have been working very hard on trying to minimize this scar. This is something if it can be minimized, it can give rise to a lot of patient satisfaction. And there we have devised what is called as scarless facelift, in which this part of the facelift is taken care of by a cut inside the hair, not at the border, but inside the hair, through which we are able to pull this. And this part is omitted, and there is a cut from here around the lobule going back, and that is also not visible. Now if you see, we do this, now you can see there is some kind of a fold which is coming in front of the ear. This is what needs to be removed, and that can give rise to a line like this in front of the ear. To overcome that and to make sure that there is no cut over here, what we do is we pull the ear a little back and see this goes off. Just this maneuver will take off the scar in front of the ear, and that is a very, very good maneuver to do. And we have a lot of patients who are satisfied with the surgeries and in whom we have avoided the scar. So this is the scarless facelift, where you get only the scar in combination of this, or even without. If you have only this, it can, laxity of this giving rise to this crease, it can be taken care of by pulling it above only through here. And if your neck and the lower part of the face is also loose, then a lower cut can come along with this maneuver. This is a fantastic procedure, and I suggest anybody interested in facelift should try this. If it is not possible, then only go for the procedure in which we can get a scar in the front. There are complications which sometimes can happen due to facelift, and most dreaded complication is any nerve injury. Now, in trained hands, that's hardly there. Very, very, very rare, and you can rest assured that any permanent palsy or a paralysis of any nerve is very unlikely. But then, yes, there's a very, very rare, still a chance for having it, and it is akin to walking on the road and meeting with an accident. There's always a chance that you can meet with an accident even if you are absolutely safely driving. So if that is not the concern, then facelift can be considered a very safe procedure in a trained hand. I hope you liked this educative video, and your confidence to undergo a facelift surgery must have increased after seeing this video. Thank you so much. See you again.